The Department of Health and Human Services withdrew $766 million awarded to Moderna to develop a vaccine against potential pandemic flu viruses. So this includes the bird flu, which Moderna was testing a vaccine for. Now Moderna says it will look for alternative funding. So Dr. Peter Chin-Hung joining us live now with all of the latest information. Thanks so much for being here. Let's talk about why the government was so concerned with bird flu.
Well, they were concerned with the type of vaccine, which is the mRNA vaccine that Moderna is using for bird flu. So that is the reason why that almost $800 million contract was pulled out. But of course, bird flu is something we've seen in this country since 2022, affecting more than 100 million chickens. That's why the price of eggs is up, more than 100 herds in many states, with 70 humans affected. So, it's not like a hypothetical risk, it's a real risk.
So can you tell us more about the type of research Moderna was doing with the government funding?
Yes, it was really, really crucial research. And the reason why is that just like with COVID, when you have something new, it's much faster to make it using an mRNA platform because you essentially cut and paste the code. And then that mRNA tells the body, hey, body, make that protein that looks like the virus, and then you make antibodies against it and protect yourself. If you use traditional technology, which is based on eggs, of which we don't have a lot of in general, that takes much longer, 6 to 8 months instead of 2 to 3 months. So if you're thinking about a fast-moving threat, mRNA technology is much more adaptable, flexible, and could have more Americans have access to vaccines because the traditional vaccines take longer, but also there aren't as many that can be made that quickly.
So let's talk about COVID-19. Just last week, the CDC removed COVID-19 vaccine recommendations for healthy children and pregnant women. So what could that mean for insurance coverage now?
Well, I think it will be spotty, and more important than that is that people will be confused and uncertain. For example, I looked up Walgreens yesterday to see if I can still make an appointment. I'm under 65. I can still make an appointment, but that doesn't mean that I won't be charged when I go to Walgreens because I already got one for this year. So I think in the same vein, people may not be confident that they won't be saddled with a bill when you go there. But some insurances won't cover it if you're not eligible, that is 65 and older, or under 65 with comorbidities. Vaccines for children, which covers all vaccines for kids 17 and younger, will likely not cover it because they are usually in step with CDC and federal guidelines. So that's why I think it's kind of a worrisome situation.
Yeah, check ahead to see if you have coverage. All right, Dr. Peter Chin-Hung, thank you so much.